Hi, my name is Regina Young. I'm the Trauma Outreach and Injury Prevention Coordinator for Erlanger. This month, there's a new Stop the Bleed program coming out, and we'll be providing free classes for all Erlanger employees. In the meantime, make sure you remember the primary principles of bleeding control. Always ensure your own safety when running to help someone else. You don't want to become another victim. We have to remember our ABCs of bleeding. A, alert, call 911, either yourself or designate somebody else to do it. B is our bleeding. Make sure you find the bleeding injury by opening or removing clothing to see where the wound is. Life-threatening bleeding can be identified by blood that's spurting out of the wound or continuously coming out of the wound. If blood is pooling on the ground or the person's clothing is soaked with blood, or maybe bandages are already soaked with blood, that's an indicator that someone still has life-threatening bleeding going on. If you see loss of all or part of an arm or leg, that means they are having life-threatening bleeding also. C means compress. We want to apply direct pressure to the wound. You can do that by either covering the wound with a clean t-shirt or cloth and applying firm continuous pressure. If you have gauze, you can use that also. Push directly onto the wound with both hands. If you have a tourniquet available, apply it immediately. You want to make sure it's 2 to 3 inches above a wound and never apply it over a joint. Always go above the joint. If the wound is in your arm, pits, your neck, or your groin area, you'll have to pack that wound with gauze or a clean cloth and apply direct pressure with both hands. Maintain pressure on the wound until relieved by medical responders. These are easy tips that everybody should know how to control bleeding.